Can I run after meniscus surgery? All you ever wanted to know about meniscus surgery and when you can return to running, including the exact steps to do to speed up the recovery process so you can run ASAP. But before we do that, go ahead and hit the subscribe button. Running with arthritis without the knee pain is possible, and it only takes a few simple steps. So go ahead and subscribe so you can know exactly what to do to run without knee pain. Hey runner, looks like you're having or already had knee surgery for your meniscus. This is a common problem and many runners get back to running no problem. The timeline of when that happens, it depends. It depends on what kind of surgery did you have, a meniscus repair or meniscectomy. Were there any complications to your surgery? Do you have other medical conditions? And how long has it been since you last ran? First, let's talk about what is a meniscus. The meniscus is a cartilage substance in your knee. You actually have two in each knee, a medial on the inner side and a lateral on the outer side of your knee. The meniscus acts as an extra cushion for your knee because of how much weight goes through the joint. Your body was made with extra cushion. The meniscus has some parts that have blood supply, about 10 to 30% of the outer zone, and other parts that don't. If the tear happens in the section with good blood supply, there's a chance the meniscus tear can heal with or without surgery. If the tear happens in other parts, there's no chance it will heal. Your body needs blood supply to heal the tissue. Why do runners tear their meniscus? Runners tear their meniscus because they put a lot of stress on their knees. And they can tear their meniscus because the typical cause of a tear is planting and twisting. This can easily happen when runners are running on trails, need to avoid obstacles, or step off the curb wrong. So how do I know if I tore my meniscus? A tear in the meniscus can be a slit, a handle-looking flap, or a rip. These tears typically happen when you're putting weight through your leg and twist. This causes a compression on the cushion and then a shear force which can tear it. Most people talk about a click, a catch, or a lock of their knee. These are classic signs of a meniscus tear. The catch and lock happen because the flap of the meniscus gets in the way of the knee moving properly. So your knee essentially gets stuck or locked in place until that flap gets out of the way. Classic signs and symptoms of a meniscus tear. The injury happened because you planted and twisted. It catches, it locks in place where you can't bend or straighten it, and it's painful when it locks in place. What is a meniscus repair surgery? A meniscus repair is where the surgeon takes sutures and sews the meniscus back together. This can only be done when the tear is in the part of the meniscus that has blood supply. If there's no blood supply, it means the meniscus cannot be repaired even if it's been sewn back together. This type of surgery is typically done through a few small incisions in the knee. What's a meniscectomy? Some people will say, what's it called when the doctor cleans up the meniscus? That's a meniscectomy. It's an arthroscopic surgery where the surgeon debrides or cleans up the meniscus. I imagine this as the surgeon takes a chomper and Pac-Mans that meniscus out of the knee. This is done through a few small incisions in the knee. How long does it take to recover from a meniscus repair? A meniscus repair takes longer to recover from than a meniscectomy because of the nature of the surgery. Since in a meniscus repair, the surgeon is sewing fibers of the meniscus back together, you'll have to stay off that leg for a minimum of 6 weeks to allow it to heal, so you'll be on crutches. After the partial or completely non-weight-bearing period, you'll be allowed to progressively bear weight through that leg and walk and do normal activity. The typical recovery period is 6 months. In general, recovery takes time. It takes 8 weeks for tissue in your knee to heal just from the fact that you had surgery. It takes 3 months for a muscle to gain strength, and it takes about 3 months to gain endurance once you do start running. How long does it take to recover from a meniscectomy? If you had a meniscectomy, total recovery time is typically 4 or so months. This is a quicker timeline because you aren't missing out on 6 weeks of putting weight through your leg after surgery like you would for a meniscus repair. Even though this is a different surgery, the same timeline of events takes place for healing. Time. It takes 8 weeks for tissue in your knee to heal just from the fact that you had surgery. It takes 3 months for a muscle to gain strength, and it takes about 3 months to gain endurance once you do start running. When can I run after a meniscus repair? After a meniscus repair, the earliest you should begin a return to running program is 3 months. Typically, the actual timeline is closer to 4.5 months. In order to start a return to running program after a meniscus repair, you need good strength on examination, no feelings of the knee giving way, controllable post-activity swelling, no swelling at rest, and no pain. The return to running program includes a variety of strength exercises and plyometric exercises, including hopping to mimic how many times your feet hit the ground during running. During the return to running program, once you can successfully, meaning pain-free and controllable after activity swelling, you can start jogging at half a mile and progressively increase by 10% every week, and every 5th week taper back. When can I run after a meniscectomy? After a meniscectomy, the time to return to running varies. Typically, the timeline to start the return to running program is 3 months. In order to return to running after meniscectomy, you need good strength on examination, no feelings of the knee giving way, controllable post-activity swelling, no swelling at rest, and no pain. If you have other medical conditions or there were complications during your surgery, these timelines will be extended. Only your surgeon and physical therapist can guide you to the appropriate timelines for your specific case. Is there anything I can do to speed up my recovery from meniscus surgery as a runner? There are things to do to help speed up the process in your recovery from meniscus surgery, and these include control pain and swelling, strength training, other cardio activities, stretching, eating right, and following the directions of your surgeon and physical therapist. Control pain and swelling. Control pain and swelling from the day you get surgery and throughout your recovery time frame. Pain and swelling are normal after surgery, but they don't have to last weeks and weeks. Control pain and swelling with modalities like ice and e-stim units. Initially after surgery, use ice for 20 minutes 5 times a day. And if you can use an e-stim unit, use that while you ice. Check the packaging to see if you're eligible to use one. As you recover, pain and swelling at rest will go away, and pain and swelling with activity is normal and must be controlled so it doesn't get out of hand. So as you go through your recovery process, every time you exercise, walk, work, do normal activities, ice for 20 minutes. If your knee is swelling at the end of the day, ice for 20 minutes before bed and elevate your leg when you sleep. For a good cold pack and TENS unit, check the link in the description. What about strength training after meniscus surgery? Strength training after meniscus surgery is important to keep the rest of your body in good shape so when you are allowed to run, the rest of your body's ready. These should include a whole body strength routine. Your physical therapist will be required to work specifically at your knee, ankle, and hip and may not be allowed by insurance to guide you through a whole body strength program. For specific exercises at your knee that requires bending and straightening your knee, ask your physical therapist. Some of these exercises may include quad sets and heel slides. A whole body strength routine includes bicep curls, overhead press, rows, chest press, triceps extension, Russian twist, dying bug moving your arms, bridging, deadlifts, planks, side planks, clamshell, 4-way straight leg raise, 3-way heel raise, and 4-way ankle exercises with the TheraBand. For good quality dumbbells, ankle weights, and TheraBand, check the link in the description. What cardio can you do after meniscus surgery as a runner? While you can't run, you can still get a cardiovascular workout. Make sure to get clearance from your surgeon and physical therapist to know which recommendation is best for you at each point of your recovery. These types of cardio could include an upper body strength routine without rest breaks, swimming, water walking, elliptical, stationary bike, and the upper body ergometer, also known as UBE. Stretching after meniscus surgery as a runner. Stretching is important for recovery after your meniscus surgery. You definitely need to stretch your knee, and the specific stretches to do for your knee is guided by your physical therapist based on what point of recovery you're at. After the meniscus surgery, it's important to get your knee all the way straight. So whenever you're resting or sleeping, have your knee out straight. This means no pillow under your knee. Any pillow under your leg must be under your lower leg, close to your ankle. A pillow under your knee will keep your knee bent and make it painful to exercise and straighten. This will hinder your recovery. Other stretches you should work on should include upper body, calf, and hip stretches, and specific stretches to your knee should be guided by your physical therapist. Many patients find that using a long strap like the one linked in the description, is helpful. Eating right for runners after meniscus surgery. After surgery, your body requires a lot of protein. It gives it the building blocks it needs to repair injured, damaged, or surgically altered parts of your body. Aim to eat 30 grams of protein at every meal. Supplement your meals with protein powder in smoothies or shakes to get as much protein as you can. Supplementing your body with collagen powder may also improve your ability to heal. Your body has lots of collagen in it, including in your meniscus and cartilage in your knees. Adding flavorless collagen powder to your morning coffee or other hot beverage can be an easy way to sneak in collagen into your diet. For good quality protein and collagen powders, check the links in the description. Follow the directions of your surgeon and physical therapist. Although this information in this video is accurate, I am not your physical therapist. I have not evaluated your situation. To heal as fast as possible to return to running, you must follow the directions. Starting to exercise a certain way or starting running too early can not only hinder your recovery, but could hurt yourself such that your knee never fully recovers. Follow the guidance of your surgeon and physical therapist to make sure you're doing everything right. If you feel like your physical therapist doesn't understand how to get a runner back to running, find someone else. If you have questions about returning to running after a meniscus surgery, go ahead and reach out to me. I've linked in the description all the socials that you can find me at and a direct link to ask me your questions about your meniscus recovery. There you have it. All you ever wanted to know about meniscus surgery and when you can return to running, including the exact things to do to speed up the recovery process so you can run ASAP. Be sure to like, comment, and subscribe. Hit that bell so you're notified every time a new video comes up so that you can run without knee pain.